Joining us right now, our panel of experts, Dr. Trupti Gilada, infectious disease physician from the Unison Medicare and Research Center in Mumbai, Dr. Vikas Maurya, senior director and HOD pulmonology, Fortis Hospital, Shalimar Bagh, Delhi, and Rajiv Das Gupta, chairperson of the Center of Social Medicine and Community Health at JNU. Appreciate you all for taking your time out for this interview. I'll start with Dr. Gilada. Dr. Gilada, now you just heard there the Indian government official statement. There's absolutely nothing to worry about. But the problem here is that when you hear China and virus in the same sentence, there is bound to be some sort of a panic.
Yes, I agree with the panic, but I also agree that there is no need to panic. So most importantly, all countries across the world see viral illnesses. And in India also, we see a peak of viral illness both during monsoon and again in winter. We will usually call it flu hua hai or some viral illness. And a lot of times, this is either influenza or metapneumovirus or respiratory RSV virus. So it's not a new virus. This is a virus that has existed, has been there for ages, and has caused upper respiratory tract infection. Of course, the most common symptoms are like flu, and therefore we will say flu hua or viral hua. It's just runny nose, dry cough, slight fever for a few days, and most people will recover at home. And that's exactly what we understand of human metapneumovirus even now. So even though China might be seeing it, I don't think it's a need to panic yet. It's not something that we are bombarded with a new virus altogether.
Absolutely. So, right at the start of the discussion, you're clearing all the air about this. Of course, a lot of speculation as well. The fact that, like I said, China and virus being in the same sentence. And I'll take this point across to Dr. Vikas Maurya. Dr. Vikas, now hmpv, Dr. Gilada there said that this is not a virus that's come out of nowhere. Like coronavirus, there was, of course, a complete difference as far as that and hmpv is concerned. But if you can just help us understand how exactly does hmpv spread? And also, what are the likely symptoms that people should watch out for?
Yes, I truly agree with that. This is not a new virus. This virus exists for ages, and now because we have technology to diagnose viruses, so we are diagnosing with the testing kits and all, and that's why we always see whenever the winter comes, the spring season comes, we see the surge in viruses, and because we are testing now more often. So we know what kind of virus is it. So we don't have to be worried about. And because like all respiratory viruses, this also spreads like, the droplet infections when you're coughing, sneezing, and not taking precautions, then other person might catch it. Then again, you touch the surfaces and again, the other person touch the surfaces, or you come into the close contact with the person who are already having these viral infections. They're going into the crowded area. So this can spread via droplet infections to those. So again, as I said, because spread like the same other respiratory viruses, so the precautions are also the same. Like, if you do not touch do not go to the close to the person who have viral infections and ask him to, to isolate themselves. And then, again, you do not touch the surfaces. You just wash your hands regularly. And you can use a mask whenever you're going into the crowded areas. That's what we always, say about respiratory viruses. So these are the important precautions which we should take. Yeah.